Hi, I'm Dr. Dale Krier. I've owned Creature Comforts Mobile Veterinary Clinic. We'll be starting our 20th year shortly, and I've been a practicing veterinarian for soon to be 30 years. And they're providing all the nursing care that they need, but when people have to leave town and they know there's no way they're going to find somebody who's going to hand feed them, sleep with them, be up with them 5 times in the night because the animal doesn't sleep through the night. So a lot of times when people have to leave town for whatever the reasons, it often prompts I think I may need to consider euthanasia. I know it's coming, and the animal's just going to deteriorate in my absence. And that's very common, where somebody leaves town, even they leave it with a pet sitter, and the pet sitter calls because the animal's not eating, they're not drinking, they don't want to go out, they don't want to, they start shutting down. It's better to do it even a week too soon than a minute too late. I would much rather that they go out on a high note, meaning having an okay day, being surrounded by family and friends a lot of times. That way everybody who needs to be there can be there, as opposed to the crisis and the emergency where you're at work or you're heading out of town.
Very concerned about my cat, who's 17 years old and very much lack of energy, hasn't been eating right, not its usual self, doesn't come when we call. How do we know when we're really getting near the end?
Yeah, it's going to change from day to day how your pet's doing, and so how you grade your cat today versus even later today or tomorrow is going to vary. So for instance, the first question to answer is a mobility question. Does your cat have good mobility?
I'd say moving, but seemingly with difficulty.
Okay, so we'll call it a 1. That's the in-between. The next question is on nutrition. Does your pet have a good appetite, a poor appetite, or no appetite?
Poor appetite.
Poor appetite. Okay,
slowing down.
We'll score it a 1. Hydration. Is your cat drinking a normal amount, a decreased intake, or perhaps you've been told that the cat's dehydrated and needs subcutaneous fluids, or no water consumption at all?
Hard to tell.
Barely making it to the litter box, sometimes maybe having accidents outside the litter box.
Yeah, that's happening.
Okay. That we're going to score 0. And then favorite things. Is your cat interested in favorite activities, chasing butterflies, whatever, in the house? Is there a decrease in favorite activities, or no interest whatsoever?
Definitely a decrease and very little interest.
Very little, okay. So that's the scale. Those are the parameters we're looking at, and the way we score things on this scale, anything 5 or under, we need to consider humane tranquilization and euthanasia. And so we've scored your kitty a 3. So that's kind of where we need to put our energies and start having that conversation about perhaps it's time for an end-of-life decision. Well, palliative care is when your pet is diagnosed with a terminal disease, a life-limiting arthritic type of a condition, something where you've made choices that you're not doing surgery, you're not doing chemo, you're not doing radiation, you don't want to do the full-blown workup of biopsies, x-rays, ultrasounds, that it's not ready to euthanize your pet, and maybe we need to put them on pain medicine, maybe we need to put them on joint supplements, maybe we need to modify the house and provide runners, or providing better nutrition. Sometimes people call and they say, my pet won't eat its dog food. And then I start asking, well, did you try this, this, and this? And they haven't thought that maybe the pet's shutting down to its own food, but animals like comfort food just like we do. So a lot of times, if we're willing to cook for our pets, the animals start eating again. Alternative treatments, Reiki, acupuncture, laser, therapeutic laser. So people have options, but most of the time They're looking to do it at home because the pets don't like going to the animal hospital in the end when they're not feeling well, especially if they're in pain. A lot of folks have a hard time physically lifting their pets into the car, and many people just say for that final visit, that final trip, there's no way it's going to happen in a hospital. They just want their pet to die peacefully at home. I've actually gone to homes thinking I had to euthanize a pet, only to find out that they haven't been recently tested for any of the tick infections. And I have an 8-minute blood test, so I can tell whether your pet has 3 of the most common tick infections that we see in this area. Certainly attended many homes where people have bagfuls of essential oils, and I'm spending a little bit of time investigating marijuana, cannabis biscuits for cats, for dogs, the CBD oil. Having worked in a traditional practice for 10 years, I kind of thought, how can I meet all of an animal's needs, servicing them in their home, and realistically I know I can't meet all of their needs, but I absolutely have patients who, from birth, from the moment they were brought into their homes until the day that they died, I have 100% taken care of their needs.